Hey guys, I am back at Dr. Austin's office. I am here for my pre-op today. Surgery is 1 week away. I am so excited.
Hi, how are you doing today?
Good, how are you?
Good. Here for your pre-op?
Yes, ma'am.
All right. So they'll give you this packet as soon as they finish when you get here, okay?
Okay, thank you.
All right.
I'm in the waiting room. They're about to take me back for my pre-op. Really not sure what we're doing. I think he's gonna go over all my instructions for surgery, what I need to do before, what I need to do after, kind of prep stuff. So I don't know. I guess we'll see what he says. Okay, thank you.
Hello.
Hi.
Welcome back.
Nice to see you.
You too. So, we're on the books.
Yes,
So, are you ready for the big day?
I am.
Awesome.
Very excited.
Have you been thinking about size-wise and proportion-wise where you like to be?
Ish. Not really. I've sent Carly some wish pictures. So I think she has those.
Okay.
Other than that, I guess I'm going to kind of let you take the reins on it a little bit.
Okay. All right. And cup size now, where are we again?
Maybe C?
C. And looking to be about a cup size bigger, 2 cup size bigger,
Cup size bigger.
5 cup size bigger,
10.
10. Okay. Got it. All right. So, the girls kind of went over your pre-op packet with you. They reviewed all your instructions with you as far as what to do between now and surgery. I'm going to go over some of the important things for you again, just to make sure that the most important stuff is covered for sure.
Okay.
Number 1, no aspirin, ibuprofen, vitamin E, fish oil, workout supplements, anything that might thin your blood 7 to 10 days before the surgery. We're coming up on that now.
Okay.
And no alcohol within about 3 or 4 days of the surgery, because alcohol will also thin your blood. We want a nice straightforward operation with no bleeding.
Okay.
Shower the day before surgery with antibacterial soap from the neck down. Shower the morning of surgery again, antibacterial soap from the neck down. Okay. If you're going to wash your hair, if your surgery's early, I recommend washing it the night before. Okay. So that way your hair is dry when you show up at the surgery center. When you get to the surgery center, they'll bring you back, they'll get you changed. I'll come in, I'll do my markings, take all my measurements and everything that I need for the surgery. I'm going to go over all your instructions with you that I need you to do from the time you leave the surgery center to the time we see you back in the office again the next morning. Okay? I got all this stuff for you. We're going to go over instructions with you over and over again. Our office will call you the day before surgery and go over your last minute instructions as well.
Okay.
Eat well the day before the surgery. Drink lots of fluids. Hydrate well.
Okay.
Okay? So, questions for me so far?
Nope.
All right. Well, what we're going to do is we're going to change rooms. We're going to get you to change clothes. We'll do our measurements. We'll do our photos, and we'll choose our implants from there.
Cool.
Okay?
Sounds good.
All right, come over, let's take a look and see. So, I took a look at your wish pics, so I have a good idea as far as size-wise where you're wanting to be.
Okay.
Okay, so I'm gonna take some measurements now so we can kind of choose our implants. So our right breast base width, 10.7. Left breast, 11.2. A little bit of asymmetry, everybody does. Sternal notch to nipple on the right, 22.2. On the left, 23.4. Nipple to inframemory fold on the right is 9.5. And on the left, 10.0. And our right inframemory fold is 0.7 centimeters higher than the left. All right. So, as far as size and proportion measurements are concerned, We had talked before about doing a straightforward breast augmentation, maybe a little bit of fancy maneuvering to try to be able to avoid a lift. The pictures that you chose has you kind of on the fuller side of proportion, which I think is very acceptable. We talked before about not going too big and not going too small. So you're going to be kind of on the fuller side. That's going to take a lot of the breast tissue and kind of fill it up and get rid of a lot of the laxity that you have. Nipple position is still fairly low. Okay, the areola are still fairly wide. You got to think when we augment the breast and we stretch the tissues over that, it's going to make the areola look a little bit wider. So with that in mind, I would recommend doing a little simple concentric or periareolar mastopexy at the same time as doing this. We talked before, it's not a very powerful lift, but it's enough to kind of reduce the size of the areola and raise the nipple position up just slightly. And I think the implant is going to take up the rest of that laxity, and we're going to be fine with just that.
Okay.
So we're going to have 2 separate scars on each breast, our access points in the inframammary fold beneath the breast, and then we're going to lift the breast by doing this little concentric mastopexy around the nipple itself.
Okay.
Okay?
Sounds good.
So, questions for me?
So one thing I kind of have heard from people who have had breast augs before, some coworkers of mine, they say that once everything heals up, they always wish they would have gone bigger.
Right.
Is that something that's normal? Should we go ahead and maybe see what a good size for me would be, or how do you kind of figure that out?
Well, based on the pictures that you looked through when you were kind of looking to try to see proportions that's going to be good for your body,
Right.
You are kind of on the fuller side of proportion. So if you're kind of leaning toward dead proportion, which is what I would have measured you for over here, or going on the smaller side, then we would have that discussion about, maybe you want to consider pushing that envelope just a little bit. I mean, you are young, so you're all about kind of body image. You work out a lot, you're all about your figure. So this is one of these things that's going to kind of improve your body image, improve your self-confidence, and improve your curves and how you look in your clothes and out of your clothes.
Okay.
So, but the implants we're choosing, we're going with a higher projection implant, which is going to give you more volume and take up a lot of that tissue.
Okay.
Okay. So we're trying to choose the implants. We have our low profile implants, our moderate profile implants, and our full profile implants based on the base width. If we want a little bit more size to the breast, we increase projection. Okay. So for yours, I'm going to go with a high profile implant, which is going to get you that volume.
Okay.
When you wake up from surgery, your breasts are going to be contracted. Okay? You have very strong muscles. They're going to squeeze those implants. Those implants are going to ride up on your chest, and you're going to swell on top of that. But even though that's going to occur, when we do a breast lift like this, you're going to look down and think that we went too small.
Okay.
Over the next 4 to 6 weeks, the tissues are going to relax. The implant's going to settle into position. Everything's going to become looser and more full and actually look bigger to you than they do right after surgery.
Okay.
Okay, so don't be disappointed when you first wake up and look down.
Okay. Cool. I trust you.
Awesome. So we'll do our photographs. So we have our before photos. I do my after photographs 6 months later, so you'll be able to look back and kind of see where you were before, because you're going to forget. Everybody does.
Okay. Cool.
Yeah. Hands by your side for me. Good. All right. So we're all set.
All right.
We'll see you in a couple of weeks. Any questions or problems, call us. Our girls will call you the day before surgery, like I said, and go over instructions with you again one last time, so we're all good to go. Okay?
Awesome. Thank y'all so much.
We'll see you soon.
Here's your homework.
Thank you.